Welcome back to Training Muscle Lengths, Part 14, the rotator cuff, plus teres major. In Part 13, we talked about all of the shoulder girdle musculature, and now we're going to talk about the musculature up in here of the shoulder joint. We're going to talk about 5 muscles here, some of which cover each other up. So this is the back side, this is the front side. We have the teres major, which is peeking out on our front side image. It's actually on the back side. It originates on the lower middle portion of the scap and runs to the back side of the humerus. And then we have our 4 muscles that we identify as the rotator cuff. The acronym we use to remember this is SITS: supraspinatus, infraspinatus, teres minor, and the subscapularis. All 4 of these muscles insert into different parts of the humerus, so they all cross the shoulder joint. Supraspinatus originates just above the spine of the scap. Infraspinatus originates on the infraspinatus fossa of the scap, basically just a big old flat portion back here. Subscap originates on the front side here in the subscapularis fossa. Again, big old flat portion on the front. And the teres minor originates on this outside portion of the scap. Just a reminder, we're talking about the shoulder joint where the humerus joins the scap. Main function of all these muscles are internal, aka medial, or external, aka lateral rotation, except for the supraspinatus, which assists the middle delt with abduction up until about the first 30 degrees or so. The teres minor and infraspinatus both play a major role in external or lateral rotation and assist with extension, and the teres minor also assists with adduction. The subscap and teres major both play significant roles in medial or internal rotation and assist in adduction. The subscap also assists in extension. For the supraspinatus, it'll be shortened once we get to about 30 degrees in a dumbbell lateral raise and lengthened when they come back down to our sides. For all the other muscles, we got to talk about a little internal-external rotation. Don't worry, this isn't turning into a physical therapy channel. So for the teres minor and infraspinatus, our external rotators, they'll be lengthened in internal rotation, shortened in external. And the opposite is true for the teres major and subscap. Lengthened in external, shortened in internal. But in terms of muscle gain, we're not saying let's go do some internal-external rotation and get a huge jacked rotator cuff. Although some people do take that approach. But remember, both of the teres muscles and the infraspinatus play some assisting role in extension, which means that when we have some sort of shoulder flexion going into shoulder extension, we will also get some stimulus. Similar concept on something like a pullover. Up next, we're going to get into the spinal erectors of the low back. That'll close out the back portion of the muscle length series before we talk about the forearms and then the abs, and finish off with a special interests video about all the weird muscles that people requested. But before you get your hopes up, no, we are not talking about the sphincter, which a very strange number of you requested on the first video. So let me know any questions that you got, and follow to learn more about the science of training.